All right, so I've worked with a company before, and as an independent contractor, I get paid per patient. So per call, that's what I do. And I was working with this company. They asked me to see these patients, per month because they have a lot of patients. They pay me once a month to see the patient, but it's like after the one time I see the patient, if the patient has 10 different requests, they have a headache and they need some medication, they need a medication refill, if they need a UTI, I'm talking, these are different days. They're complaining of different things and they want to call me to see them. And when I go ahead and see the patient, guess what happened? The one I complain, she said me not supposed to bill her because she already paid me one visit. So me tell her, I say, I say it go. And I say it go. Me work per call. You ask me to see the patient, I'm definitely gonna be seeing the patient and you're gonna be getting a bill. So it's not one call and you pay me a flat fee to see the patient every single time for the month. Just like in the emergency room, when they do get discharged and come back, them get a fat bill. So what the difference between me and you? You understand? Not because you probably don't want to bill the insurance for whatever reason, it doesn't mean that I'm not going to be billing you. If you're in a situation like that, do not let people take you for granted and think that you're out there working for free, because especially when you're new, they kind of twist things and make it seem like it's the norm for everybody. But as you get into, the practice of working as a house call nurse practitioner or a nurse practitioner, you will realize that, I know, so it go. The people them just want ways and means of making sure that their patients in the house call setting are comfortable, but then make sure your pocket comfortable as well. So make sure every call you do and every encounter you have with a patient, document and bill the company. You understand? Because your nurse practitioner advice, your prescription that you're sending out, any form of treatment that you're doing outside of that one call that they, them claim say they want you to see the patients each month, it comes with a price. You understand? You're not working for free. So I'm just letting you know that. Anyways, I'm gonna go out and see my patients. This company is going to be pretty nice. I like how they do their billing, and I will tell you a little bit more about it when I get a chance in another video. All right, remember to subscribe to my YouTube page at Think Nursing and follow me here on TikTok for more. Until then, I will see you in the next video. Bye.